morning, everyone. For those of you who are new to the area, welcome. We're delighted to have you here. We hope that you're enjoying both the conference and also the offerings of the area and of Stanford, which of course is very close by. I thought I would remark just briefly this morning on two topics that I think are relevant to the goal of this conference. The first is on the digital transformation of healthcare, and biomedicine. And then closely related to that is the way that this digital transformation is changing the way we deliver healthcare, and in particular, enabling us to deliver on the promise of precision health. And then in those remarks, really to weave in how we as medical educators can leverage the opportunities that the digital revolution, I think, affords to us. You know, we're in a conference center this morning that is situated on Sand Hill Road, which, as you notice driving up and down Sand Hill Road, is really the venture capital headquarters of the world along this mile or so strip here. And one of the prominent venture capitalists in the area, I won't use his name, and I are oftentimes on panels together, and he likes to turn to me during the discussion and say, you know, I'm going to put you and your medical school out of business in the next decade because there's not going to be any need in the future for physicians or other traditional healthcare professionals. Everything will be done by data scientists. You know, I have a lot of concerns today about the world, about medicine, medical education, but being put out of business in the next decade is not at the top of that list. But I do think that the digital transformation of healthcare, and biomedicine offers us as educators, as physicians, as healthcare providers, a unique opportunity to return the high-touch aspects of medicine because those high-touch aspects are enabled by high-tech. When I think about the digital transformation of medicine, and broadly speaking, digital health, there are two categories, two verticals that come to mind. They're related, but I think they're distinct. The first is the technology associated with consumer-facing devices and wearables, and the information that can be obtained from those. And then the second is our ability now to bring together large quantities of data and extract from it meaningful information that can better guide decision-making and help us all as healthcare providers be able to interact better with our patients. Now, in the area of consumer-facing devices, you know, it's incredible, the information that we now potentially have available through devices that are out there and that will come on the market very shortly. In an article in The Economist a year or so ago, it was estimated that 80% of people on the planet, 80% of adults on the planet, will by 2020 have access to a smartphone. You know, that's going to already is revolutionize the way we can communicate with people and also the way they can communicate with each other and with us in healthcare delivery systems. We're doing a few things in that regard to try to, both in our own healthcare delivery system and also in the research that we do, really help to fuel this transformation in consumer-facing devices. One is we announced last year a partnership with Apple on the Apple Heart Study. The Apple Heart Study uses Watch in order to screen for detect arrhythmias. You know, atrial fibrillation, we think, is the most common arrhythmia, but today we really don't know the true prevalence of atrial fibrillation. Why? Because it's oftentimes intermittent. And therefore, we really don't have adequate data to inform what we should be doing to treat atrial fibrillation and its various different manifestations. We hope that by using Watch, which is the most commonly used heart rate sensor in the world today, by using the rhythm and rate information from Watch combined with information about your activity level that comes from accelerometers in the iPhone and in the Watch, we'll be able to get some inferences about whether or not you're experiencing an arrhythmia and then confirm that with further testing and really see if watch can be used to diagnose and monitor cardiac arrhythmias like atrial fibrillation. And of course, all that data coming in from digital devices and technologies can be combined with data already in the existing health record in order to really drive the type of deep learning that can help us make more informed medical decisions. You know, machine learning, artificial intelligence have really transformed every other aspect of the economy other than healthcare and healthcare delivery, right? I mean, the way we buy goods and services today is totally different than the way we bought goods and services even as recently as 5 years ago, certainly as recently as 10 years ago. And yet today, if we were to walk over to Stanford Hospital or in one of the physician offices in our areas, or any of the areas that you come from, we would probably see sitting on a counter a device that's the equivalent of a dinosaur in every other industry today. And that device is a fax machine. I mean, where else do you see fax machines today? And yet still, that is a very commonly used way of transmitting information about health and healthcare from one point to another. Really, we ought to be able to get beyond that. And another example, you know, we can type in a list of symptoms or signs into Google and come up with a number of different websites that help us narrow our search and understand what we need to do as next steps in the investigation of what could be the cause of those symptoms and signs. You type in those same keywords on the cheap and blend line of a record in an electronic health system, and we as healthcare providers get absolutely no assistance in making a diagnosis or understanding what the next steps in the decision tree might be. I mean, we could certainly do better than that. And I'm pleased that on June 4th, we here at Stanford Medicine will host a national conference on the electronic health record, bringing together leaders of healthcare systems, medical educators, the EMR companies, as well as people from CMS and HHS to really look at where we are today and what we need to do to get beyond where we are today. So digital health, both consumer-facing devices and machine learning AI-enabled interpretation of the treasure troves of data that are coming in, I think has the potential to change the way we deliver healthcare, and more importantly, change our perception as consumers, as individuals, of what health is and how we can be better engaged in health, and in turn, how we as healthcare providers can really get back to the high-touch aspects that I think in most cases is the main reason that drove us to consider a career in medicine to begin with. Now just to finish up, let me mention our overall strategic goal here, which is to lead the biomedical revolution in precision health. So I'm using the words precision health. I didn't say precision medicine. And I think there is a key difference. Now we for sure do precision medicine at Stanford, as do all of you in the environments you come from. We have the latest generation in terms of Cancerino therapies. We've been a pioneer in heart transplant surgery since its inception with Dr. Norman Shumway now 50 years ago. But really the opportunity moving forward is to take the same enablers of precision medicine, which is not sick care, taking care of us when we're sick, take those same enablers of genomics, data science, regenerative medicine, and apply those in a predictive, preventive, proactive way so that we prevent disease from occurring in the first place, and when we can't prevent it, so that we diagnose it much earlier, therefore treat it more effectively. So predict, prevent, and cure are the three aspects of precision health, and really in that order. Let me mention just brief examples under each of those categories. In the area of prediction, with genomics, combined with a lot of other different digitally enabled testing modalities, evaluations, we now are able, we're at the cusp of being able to, at an individual level, predict our propensity for disease. We partnered with Verily, which was formerly Google Life Sciences, last year to launch the Project Baseline. Baseline you can think of as being like the Framingham study on steroids. Framingham just celebrated its 60th anniversary as a biomedical study last year. And we could spend the entire day talking about the valuable information that's come from Framingham. But we're even more excited about what Baseline offers. Baseline will enroll 10,000 people. It's a longitudinal cohort study, and everything we can imagine about their health will be measured. Genome sequencing, microbiome, immunome, Verily developed its own wearable specifically for this study. And we'll gather all this information from these 10,000 people, and they'll be tracked longitudinally. And now for the first time, we'll have information for those patients with cancer today. Whether or not they go on to relapse or not, we'll have information about early indicators of what might have been a predictor. Or for the people who have no diseases today, how an early sign might have predicted the later development of disease. The goal here is to be able to, for each of us, develop a specific plan of prediction that then can lead to prevention of disease to begin with. And diagnostics as a field is really, I think, on the cusp of a renaissance with cell-free DNA testing, with a variety of other diagnostic modalities, both imaging as well as chemically based, that I think for each of us will also offer the opportunity to have a specific diagnostic plan so that cancers, for example, that you traditionally only diagnose very late, like pancreatic and ovarian cancer, will now be able, based upon our knowledge of our propensity for the development of those diseases, design a diagnostic profile that would enable us to detect them much earlier. So prediction is the first step, and then that really leads into prevention. The Apple Heart study that I mentioned is a good example of prevention. It may be that we discover that there's some intermittent episodes of atrial fibrillation in people that don't need to be treated at all. Or that there are some people that have continuous AFib that are at a very low risk factor of the consequences of AFib. By being able to better tailor prevention strategies, it's not a one-size-fits-all approach. It's an approach based upon an informed assessment of the risk factors that each of us has for the future development of diseases or consequences. Now, we know we're not going to be able to predict and prevent everything. So yes, we will continue to need to focus in medicine as a discipline and at Stanford Medicine on what we can do to more accurately, completely, thoroughly treat diseases and cure them when they occur. Certainly the one example I would mention in that area that I think has all of us in medicine excited is cancer immunotherapy. We've seen more advances, more truly unique, impactful advances in the treatment of cancer over the past decade, I think, than in the prior 3 to 4 decades. Cancer immunotherapy is here to stay. We're still not exactly sure how generalizable CAR T-cell therapies are going to be, but for sure we're going to find that out in the next 5 years or so. The introduction of checkpoint inhibitors, I mean, just think about it. Isn't it amazing and wonderful that President Jimmy Carter is alive and doing well today with stage 4 melanoma over 2 years after the diagnosis because of a checkpoint inhibitor? A disease that is almost 100% fatal within a short period of time that now is being kept under control by a simple therapeutic. I'm confident we're just scratching the surface of how the immune system can be leveraged in the treatment of cancer, and then from that to a much broader class of diseases as well. So I wish you well. Enjoy the conference. I hope that it proves to be valuable to you, and also from all of us at Stanford, we hope that this is not your only contact with us here. We welcome your feedback and always welcome you back here as well. Enjoy the day. Thank you.